Hello, Nikki. Thank you very much for coming here today. I know I invited you along to discuss sharp safety, and some kind of needle stick injury stuff.
Okay. So what type of things have been happening that's...
So we've noticed that our needle stick injuries aren't really reducing as much as what they could and should be, given that many years ago, 5 years ago now, there was a European directive where all health board institutions needed to, where there's a sharp, needed to provide a safe sharp. And our health boards up there, they've done that where possible. But we're noticing that our needle stick injury data is still kind of plateauing rather than coming down.
Okay.
So just thought we'd have a wee discussion around that.
Okay. And who does this discussion, who does it pertain to?
So, Nikki, do you remember the Health and Safety Executive? They came round our health board in March 2017.
Yeah.
And they looked at various things, but they looked at how we use our sharps devices, and they were not satisfied that enough of us knew the use and discarding of our sharps devices. Okay. So they came up with 2 action plans, and one of those action plans was that everyone who manages a sharp needs to get face-to-face awareness sessions on how to use those sharps safely.
Okay, so what kind of staff manage sharps then?
Anyone in the clinical area, Nikki, so healthcare support workers, because quite frequently we ask our healthcare support workers to do blood sugar testing, venipuncture, cannulation. As staff nurses, they do venipuncture, cannulation, etc., IV medicines.
Okay.
So clinical staff.
Okay, and that include medical staff as well?
Absolutely, includes the medical staff as well.
Okay.
So the junior doctors, as they come in, they're given this information on induction, as do new nursing staff, bank nurses, etc., all get it on induction. But yes, across the board, medical staff as well. So that was one action point, the face-to-face awareness. The other one was Learn Pro modules.
Mm-hmm. Okay, and what modules is that?
So it's two modules. One is it's the GGC module, management of needle stick and similar injuries. Okay. And the other one is a NES module, and it is prevention and management of occupational exposure.
Okay, and are they mandatory for all clinical staff?
Mandatory for all clinical staff who use sharps or are at risk of getting a needle stick injury.
And what's the consequences for staff if we don't, as a clinical staff member, if I don't undertake this learning?
Well, the consequences are quite extreme, Nikki, in that if I take blood from you and I get a needle stick injury because I've managed to, maybe something's gone wrong somewhere and I get a needle stick injury, I know who that source patient is, and I can ask someone to do the risk assessment for me, okay? But our DATEXs are telling us that our downstream colleagues are getting needle stick injuries, such as our domestic colleagues, our portering colleagues, and our laundry colleagues. So by the time they get a needle stick injury, they've no idea. They've no way of telling who that source patient is, so they can't do the needle stick injury. And you're clinical, you know that totally adds to...
Yeah, absolutely. It must be a real worry for staff who've no idea where the needles come from or what it's been used for.
Yes, exactly.
Okay.
Exactly, yes.
Okay.
So... I know. When you're teaching this venipuncture, cannulation, etc., I know you say things like all sharps should go from skin to sharp spin, from skin to sharp spin, and everyone should be taking the sharp spin to the bedside.
Yeah, absolutely.
But we know that doesn't always happen.
Yeah.
We know it doesn't always happen. But in an effort to minimise the risk to others then, we would like you to demonstrate some of the kit that you've brought along.
Yeah.
We know it's safety devices, but we don't know that everyone knows that.
Yeah.
And if you could just give us a wee demonstration.
Absolutely.
Thank you.
Yeah.
Thanks.
And certainly through teaching that I've done, I've come across, as you say, staff who don't know the correct way, or maybe do know that it is a safety device, but don't know just exactly how to do that. So first of all, we'll start off with the cannulas that we use. these are most commonly found in Greater Glasgow and Clyde. Most areas will use this
Yeah, I've seen that one.
cannula here. So it's got a port on the top of it. Let's move that to the side. So that's what that looks like. And the other cannula that's in use, but not in all areas,
No, not seen that one much.
fairly similar, but it doesn't have a port on.
Right.
So both are fine to use. The clinical area that I work in deals with chemotherapy agents, so we've made the decision not to have the port because we don't want staff exposed to cytotoxics if they were to put a syringe into there, and also it's very difficult to clean. So that was a risk assessment that we made a number of years ago. So both cannulas, when they come out of the packet, the clean needle is covered with a sheath. So you just take care to take the sheath off, and then you've got your needle. So if you're doing your cannulation, insert your needle, and then you secure the wing with a finger and pull back on this valve at the back. Careful not to take that bit off. Okay, so there the needle is covered, and there's no way that you can jag yourself at all, and that would go straight into the sharp end. Of course you can.
So if this we know that adverse events tend to happen due to distraction, etc. So in this cannulation, if something was to go wrong at this moment in time, and I was to discard this not in the sharps bin, if it was to go in the laundry, if it was to go in a black bag, orange bag, etc., I suppose this block here has minimised the risk of our downstream colleagues getting a needle stick injury.
Yeah, absolutely. And since you mentioned that, a situation where that may not be activated, I'll just demonstrate with this other type of cannula. When you're doing your cannulation, and if you have a failed attempt and you can see that the vein is bruising, you might quickly pull the cannula out to apply pressure. But you've now left with a cannula that
sharp, absolutely,
still has a needle in place and is dirty. You know, it has the patient's blood on it. So that is a real risk, particularly in, as you say, emergency situations where that may get put down on a surface rather than straight into the bin. So in this situation, then what we would be asking you to do is apply pressure to the vein, secure the wing.
Right.
And pull that back.
Because there's a safety device on
that.
There. And if this was to land in the bedding, and then that bedding goes to laundry, the next person downstream is less likely to get a needle stick injury because there is a safety device over it.
Absolutely.
Okay.
Absolutely.
Good. Excellent.
So that's those devices, and as always, sharp spin should be close at hand and straight into the bin. Excellent. With those.
Good.
Okay.
Excellent. What else have you got, Nikki?
So the next pieces
Nikki,
of equipment...
could I just go back? Could I just ask, are cannulas all safety devices?
They should be, unless there is a particular clinical need that would preclude you from doing that.
Right. So it's not clinical preference. It has to be clinical need. Absolutely. It's not personal preference. It's clinical need.
Absolutely.
Okay. And it's health and safety that then decide if that's going to be approved or not. Okay.
Absolutely. Yeah. And that may be the same with other pieces of equipment that are around, but no matter what it is, it should be
grand. Okay. So what's that you've got there?
So this is a needle, hypodermic needle, that we will use for either injecting patients if they need a subcutaneous or an IM injection, or also you may use that for reconstitution of drugs.
Okay. Do you know, I only ever remember them as a straight up and down needles.
Absolutely.
Why would you need a cover on it?
Absolutely. So again, when you remove the sheath that keeps that covered when it's in the packaging, there's no safety on that, so this part is the safety. As you see, I was going to demonstrate with my hand
and how not to do it,
and that's absolutely something that you shouldn't do. Many nurses, for quickness, do that, but it should absolutely be the closest hard surface. So you put the flat of that on, and you'll hear a click, and then that is covered. And again, it should go into the nearest sharp spin.
So
that you have.
near a solid surface, click it shut.
Absolutely.
And that doesn't mean walking to a solid
No.
surface, because
No,
you
no.
will always have a solid surface
Wherever
close by
you are.
you. It could be the bed table, it could be
A trolley.
the trolley or anything,
Yeah,
but near a solid surface, click it shut.
Yeah, and not your hand.
Right, and not your hand, not your
hand.
thigh or anything.
Yeah, no.
Yeah, okay.
Yeah, absolutely.
Grand. And sorry, are they all safety or
No, so there are, depending on clinical procedures, there are areas that, as you see, the safety device could actually, it doesn't move
it's
other than
fixed,
forward
it is
and back.
fixed,
So that actually could get in the way of doing the clinical procedure. But again, these are all things that are discussed with health and safety to see if there's a suitable alternative.
Right, and then a risk assessment needs to be done,
Yeah.
because that is right over the beveled edge,
Yeah.
and it's not movable. That's right. So some clinicians might obscure their view.
Yeah, absolutely.
Right. Okay.
So,
grand.
okay.
Great. What else have we got?
So
Nikki?
the next procedure you may be doing is phlebotomy, and there are two variations for phlebotomy. One thing that I would like to point out is that could be a risk, because this vacutainer is intended to go with this butterfly with collection set, and these pieces of equipment are to go together. But there is the quick shield, absolutely. But there is a risk that you could marry these two bits together.
I've seen
and that there's absolutely nothing, no safety aspect of this. When you pull that apart, your rubber sleeve covers the needle there. So
Or is there a needle under there?
there is absolutely
Right.
a needle. I'll show you carefully. And
Oh,
it's
right,
quite thick.
okay.
It's quite
And
thick.
we've had reported needle stick injuries from this back end.
Yes,
Yep.
So that needs to, the back end, the back end of these are the same in both devices, and they absolutely need to be covered by a vacutainer. If you attach your blood bottle without that, that's potentially where staff are being injured. So, so if I demonstrate, so that also is a big needle. There is no way to make that safe. Absolutely. So those two bits of equipment,
And
you
I
should
can
take
see,
care.
Nikki, how if I'm taking blood from you with this,
Yes.
okay, and at this moment in time you decide to go 2 shades paler, and I start to worry about that, then I'm not thinking skin to sharp spin anymore.
No, you're just thinking.
I've kind of lost that as I'm thinking what's happened to Nikki.
Yeah.
And this goes on the floor, the bedding, the black
Absolutely.
bag. That this is absolutely not the right thing to do.
No, you're right. You're right. So I'll show you the way the two pieces of equipment. So great care needs to be taken to make sure you're using the correct pieces of equipment together. So again, everything's covered when it's in the packet so that it doesn't stick out, and to keep it sterile. So you have your needle under this sheath here, and that goes into your vacutainer and twisted round. And then you remove the sheath from this other end of your butterfly and bend your wings back, and then carry out your phlebotomy. So the way to activate the safety in this is there's plastic clips. I don't know if you can see them there. So you would apply your pressure to the entry site, secure the wing with a finger so that it doesn't fly out and give yourself a needle stick injury. And then you press the two clips at the side and withdraw that back, and you'll hear a click.
I heard that click.
So then you know that doesn't come out. And there's sometimes a temptation for staff to withdraw the needle from the vein and then activate that, but there is a risk there that could slip from your finger and
I see.
And jag you. And some people often say, well, you know what, everything's going into the sharp spin, what's the need to cover? But things like these, so we use these in my clinical area because veins are pretty fragile, but actually when you're finished with it, this long tube becomes a bit of it can become a bit of a risk. So when you put that in the sharp spin, even though that's in the correct place, it could be sticking up the way, and then the next person that puts something in the sharp spin gets a needle stick injury. So that's why we say all sharps, even if you're 100% sure it's going in the right place, it should be activated to reduce that.
So am I right in saying that the only time that you should see that needle is when it's clean?
Absolutely.
Because we shouldn't see it once it's out of the patient. Once we're finished with that phlebotomy, we shouldn't be able to see it because it's retracted.
Yeah, absolutely. So if you inspected your sharps bin,
you shouldn't be,
seeing any needles just all covered. So then this is another version of a phlebotomy set, which is probably more commonly used in clinical areas. So again, pull off the grey sleeve and then twist that in to the vacutainer. So this is the safety aspect of this device. So then do your phlebotomy. Okay, apply your pressure to the vein, and on your nearest solid surface, click it in.
That's a definitive click, isn't it?
Absolutely, and that's quite clear to hear. Great. Obviously, you're not risking blood spill everywhere. Do it as close as you can, and then straight into the sharps bin. Okay.
And then even in any kind of circumstance that's not nice and controlled and calm, if that was to go into the bedding or anything, we're safe in the knowledge that it is a concealed needle, and unless you really fight with it, it's not going to come out.
Yeah, absolutely. So the last bit of equipment is our insulin needle. So again, in the packet, your needle is covered. So you remove that.
So the needle is bonded onto the syringe there, isn't it?
So it comes as one piece of kit. So again, when you're in the patient's skin, in order to activate that, do that whilst it's in the skin. So this small plastic lip you press on, and again you'll hear a click. That can go, if you don't push it all the way up, the needle is covered, but there's nothing to stop that coming back, so you need to hear the click. So that's all the bits of equipment. Obviously there are other kind of less commonly found bits of equipment, as you said at the start, but that across the organisation, it's
the most commonly
used pieces of equipment.
Excellent, thanks, Nikki.
No problem.
So really, is it safe to say that sharp safety works in kind of three main principles? Whatever the device, and one is near a solid surface, click it shut. And the second one is that it retracts back into the housing.
Absolutely.
And the third one is that we have a lid that goes over the needle, as with the insulin syringe. Is that correct?
Absolutely.
So am I also correct in saying that even though we'll get more safety devices along, they will work in the same principle?
Yes, absolutely. That.
Posters and stuff, is there information available on that?
There's information in all the clinical areas, but if you feel that you maybe don't have the most accurate information, you can find that on StaffNet.
Via Health and Safety or Practice Development Department,
absolutely.
Is that correct, isn't it? Okay, excellent, good. Is there anything else to add to that?
No, I think that's just, raising awareness and trying to make sure people, everyone's trying to do the right thing, but, just pointing out these small points can make a difference.
Excellent. Thanks very much, Nikki. Thank you.
No problem.
Thanks.